The purpose of this video is to train you on how to respond if a child has a seizure on your bus.
Before we can talk about how to appropriately respond to a child having a seizure on your bus, we must first discuss what a seizure is. For that, we have Dr. Stacy Epps. He's the lead neurologist at the Bon Secours Medical Group in Richmond and the vice president of the Epilepsy Foundation of Virginia. He will tell you exactly what a seizure is, as well as some basic first aid you need to respond to a child having a seizure.
I'm Dr. Stacy Epps. I am the lead neurologist with the Bon Secours Medical Group here in Richmond, and I'd like to give you a little information today about epilepsy and about epilepsy safety and seizure safety. So what is epilepsy? Epilepsy is recurrent, unprovoked seizures, meaning seizures that happen without an underlying reason, such as a low blood sugar or a low blood salt. These seizures that occur can best be thought of as an abnormal electrical storm in the brain, such that you have a group of brain cells that become overly excited, and because they're overly excited, they fire abnormally. And depending on where this storm occurs, you get the different manifestations that we see outwardly as seizures. Seizures come in many forms. The simplest type of seizure is what's called a simple partial seizure. This is a simple partial seizure, where just one body part moves. There's no alteration in consciousness. The patient is awake. He knows it's happening. We go to what we all think about when we hear the word seizure, and that's the dramatized version we always see on television, and that's the convulsion or the generalized tonic-clonic seizure. This is where the patient will fall into the floor, their arms will stiffen, their legs will stiffen, they may have a guttural type moan as air is forced out of the lungs from the diaphragm contracting, and they'll shake, they may foam at the mouth, they may bite their tongue, the patient may lose control of their bodily functions. That's the most dramatic. In between, we have something called an absence seizure, which is very common in children and adolescent age young adults, where they just have a momentary loss of awareness. They're in the middle of a conversation, they stop, they stare, they may have some fluttering of their eyelids, they may have some movement of the mouth, but they come right back to themselves after just a few seconds. These are very brief. The next type of seizure is something called a partial complex seizure. This is where the seizure manifests itself as, again, a loss of awareness, stopping what you're doing, and you may have some turning of the head, an arm may go up, there may be some shaking of the limb, and after a few minutes, it resolves, the patient starts to come back awake into himself. In terms of seizure first aid, what to do if you come upon someone having a seizure or someone you're with has a seizure. The most important thing is to stay calm. If you don't stay calm, you cannot help that person. Seizures can be very alarming to people, particularly if someone's having a convulsion, but you need to set that aside and think about the patient. Stay calm. The next thing is to keep the patient safe. With some of these seizures, people may fall to the ground. You try to lower them to the ground if you see that they're falling out of their chair. If they're on a bus seat, for example, and they start to slide down, lower them into the floor. Protect their head. If they're shaking, their head could bang against the floor, it could bang against the post of the seat. Put a jacket underneath their head, put a jacket or a backpack between the patient's head and the post of the seat, anything to keep them safe. Never ever hold a patient down. By trying to stop these movements or the shaking, you do nothing but potentially cause extra harm. You can break bones, you can cause a shoulder to be dislocated, so never hold them down. And probably the most important myth to dispel is that the patient may swallow his tongue. Never ever put anything in a patient's mouth. He is not going to swallow his tongue. However, if you put something in his mouth, he could bite it off and swallow that, taking it down into a lung, causing more problem. He could bite your finger if you put your finger in his mouth. So never put anything in his mouth. Patients are breathing during seizures. They don't breathe as efficiently. You may see some blueness around the lips. That's okay. Once the seizure is over, place the patient on his side. That way, if there are any secretions that were in the mouth, they come out of the mouth and not back down into the lung, causing a potential pneumonia. So stay calm, keep the patient safe, never put anything in the mouth, never hold the patient down, put them on their side and let them recover.
3 of our epilepsy heroes, Nia Bennett, Sue Dunbar, and the Executive Director of the Epilepsy Foundation, Suzanne Bischoff, will show you how to appropriately respond to the 2 most common types of seizures a child might experience on your bus. First will be a complex partial, followed up by the more dramatic tonic-clonic seizure.
So we will start with a complex partial seizure. Now Sue, you don't grab onto him because then he might lash out unconsciously. But you stand in front of him. Don't touch him and just try to lead him very calmly to safety. Stand in front of him that he doesn't look in the sea. Sit down. And you leave him there because he's very safe, and then you can pull over and take measures. You've pulled over and you try to his airways stay clear and move him on the side and put something under the head. That way he doesn't hurt himself. And then let it go, and you can call the emergency or whatever number the school protocol tells you to call.